Well, greetings everybody. This is Jim Hovland, your Edina Mayor, and it is Wednesday, December 8th, 2021. Before we talk today about the Omicron variant, I want to tell you a little bit about what happened to me last night. A story after City Council. We worked late. I think I left City Hall about 12:15 this morning. And instead of going down Highway 100 like I usually do, I thought, well, I need to unwind a little bit. I'm going to take the long route home. So I drove down past the community center and around on Valley View, down past Valley View, Wooddale, and the little mall there and Town Hall Station, and down around Valley View and underneath Highway 62 to the park. And I turned by the park and started heading west on 66th Street. Now it's about 12:20, and I get to the lake part of the park, and there's a person walking along the sidewalk in the middle of the night. I'm the only car out there. It's 4 degrees. And I could see that it was a woman. She had a pretty good coat on. She had a hood on her coat, and she's carrying a great big handbag. And I didn't know if I should stop or not, and I didn't, because I was afraid I'd startle her. Maybe it was somebody that couldn't sleep out for a walk. But when I got to my driveway, I called 911, Edina 911, and told them what I had seen. And they said they'd send somebody down from the PD to check on this person. And then I got a call back from the PD and saying, sure enough, they had found her walking along the lake down on 66th Street, along the pathway down there. And she had left Fairview Southdale Hospital. And I don't know what the circumstances were under which she left Fairview Southdale Hospital. But she had decided that she was going to walk all the way home from Fairview Southdale Hospital to where she lived in Eden Prairie. Now, I don't know if she would have made it or not, but it just goes to show you that sometimes life is serendipitous. And I was so grateful today that I had gone home that way, gone the long route home, for no good reason really, other than just to kind of air things out a little bit and calm down a little bit after that long city council meeting. So. Anyway, it's a story of what happens sometimes in life. I can't get over the fact that this person was out there in the middle of the night. I don't know what the situation was, why she was in the hospital. But I'm glad she's alive today. And it does seem quite serendipitous that I just sort of on a whim decided to go home the long way. So let's talk about this Omicron variant. You all know last week our state lab confirmed Minnesota's first COVID-19 case involving the Omicron variant. The variant was found through the Minnesota Department of Health Variant Surveillance Program, one of the strongest programs of its type in the nation. This news, of course, is concerning but not a surprise. We know this virus is highly infectious, moves quickly throughout the world, and adapts to new circumstances and is constantly morphing into something else. This new finding, however, underscores the importance of continued efforts by all Minnesotans to limit the spread of every type of variant, whether we know about it or yet to come on this COVID-19. We have to use the tools we have available to make it as hard as possible for the virus to spread. So getting vaccinated is number one. That's the most important thing you can do. Get vaccinated and get a booster when you're eligible to get a booster. I think that booster is critically important. Wear well-fitting masks indoors, in public settings, and crowded outdoor settings. Make sure that you improve the ventilation in your home and workplace if at all possible. Get tested if you have symptoms. You've been exposed to someone with COVID-19. You've traveled or been to a setting where you might have been exposed. And if you're sick, make sure you stay home. Stay away from crowds. Make sure you wash your hands frequently. Scientists are working to determine how the Omicron variant may compare with the predominant Delta variant in terms of transmissibility and disease severity. Scientists are also studying the degree to which existing vaccines and therapies protect against it. Really, therefore, extraordinarily important that you get a vaccination if you haven't had one. Our hospitals are full of people that haven't been vaccinated. They weren't sure it was the right thing to do for whatever reason, but you need to get vaccinated. I just spoke to Fairview Southdale a couple of days ago, and they're busier now in the ICU unit than they were in May of 2020. the stress on our frontline workers in the healthcare industry is just extraordinary. So please, please, for yourself, for your family, for everybody in our society, get a vaccination. And if you can get that booster, if you're over 18 and eligible for a booster, get that too. This is Jim Hovland. That's your Mayor's Minute. We're going to get through this together, but let's get through it together the best way possible, and let's all get vaccinated so that we can protect each other. Thank you.